Welcome to the VA Northern California Healthcare System colonoscopy prep video. This video will help you prepare your upcoming colonoscopy appointment. You should be receiving a letter in the mail with instructions specific to your appointment. It is critically important that you review these instructions when you receive them and then save them for the future reference if needed. You might consider taking a picture of the instructions or adding the dates to your personal calendar to remind you. If you have not received the prep instructions or prep medicine 2 weeks before your colonoscopy, please contact the GI department. Planning for transportation. You will not be able to drive for 24 hours after having sedation. If you wish to be sedated during your colonoscopy, you must have a driver or companion. Your driver must be at least 18 years old. If you are taking a taxi, Uber, or VA shuttle, you must still be accompanied by an adult to ride with you for your safety. Your driver or companion must check you in at the GI clinic desk upon arrival and check you out upon discharge. Your driver should plan on staying near the GI clinic for 4 hours after checking you in. If you cannot find a driver, you may consider having your colonoscopy without sedation. This option is not available if you are having an upper GI endoscopy or an EGD on the same day. Blood thinner medications. We usually remove abnormal growths or polyps from the colon when we see them during the colonoscopy. There's a small risk you could bleed from the polyp removal site. Blood thinner medications can increase your risk for bleeding. Please contact the doctor who prescribes your blood thinner medicine for instructions for how many days before your colonoscopy you can safely stop your blood thinner. Do this at least 2 weeks before your colonoscopy appointment. Some blood thinner medications should be stopped several days before the colonoscopy to give them time to wash out of your system. Do not stop your blood thinner medications without instructions from your doctor. Sometimes it is safer to delay your colonoscopy, especially if you had a recent heart attack, stroke, blood clot, or stent. These are the names of some common blood thinners. Please note, as new blood thinners come on the market, this list may not be inclusive. 7 days before the colonoscopy. If you are taking aspirin, the 325 milligram dose will need to be decreased to 81 milligram the week prior to the procedure. This will reduce your risk for bleeding. If you are taking 81 milligrams of aspirin, please continue to take this medicine directly as prescribed unless you receive instructions otherwise. Stop iron pills, also called ferrosulfate. Iron pills can turn the stools dark, which can make it harder to clean out your colon. Fish oil is to be avoided as well, as it can appear oily and blur the lens of the camera. 2 days before the colonoscopy. Stop eating fresh fruits, vegetables, nuts, and seeds. These will clog the colonoscope and block the camera lens. At 8 p.m., take the first 3 tablets of bisacodyl with a large glass of water. This is a laxative, and you should start having a bowel movement within 6 to 8 hours. The day before the colonoscopy. You will need to stop eating all solid foods and start your clear liquid diet. Drink plenty of clear liquids. This will help you clean out your colon better and you will feel more hydrated. You can drink any of the clear liquids listed on the instruction sheet you received from the GI department. These include water, broth, clear juice, clear soda, and coffee with no cream. You will need to continue drinking just clear liquids all day. Do not drink red-colored liquids because they can be mistaken for blood during the colonoscopy. Do not use any form of marijuana at least 12 hours prior to the procedure because this can interfere with sedation. At 8 a.m., you will take the last 3 tablets of bisacodyl with a large glass of water. Mix your bowel prep by filling the golightly container to the fill line with water. You can add sugar-free flavored powders such as Crystal Light Lemonade, no red, to help with the taste. Please shake well prior to drinking. Some people find the golightly is easier to drink after being refrigerated and also by using a straw. Only follow the written prep instructions you received from the GI department for split dose prep. Please do not follow the instructions attached to the container of the golightly that you received from the pharmacy, as these are printed on the label by the manufacturer and cannot be changed. Our instructions are different. From 6 p.m. to 8 p.m., start drinking the first half of Go Lightly. Drink 8 ounces every 10 to 15 minutes. Do not rush. Once you have finished half of the Go Lightly, go back to drinking the clear liquids until you go to bed. It is important that you only drink half of the Go Lightly in the evening. The other half will be finished the following day when your procedure is going to be performed. Splitting the medication the night before and the morning of helps clean your bowels more thoroughly than drinking the Go Lightly all at once. If you are diabetic, take half of your usual insulin dose at nighttime. It is okay to still take your metformin if you are prescribed this medication for diabetes. The day of your colonoscopy. On the day of your colonoscopy, 5 hours before your scheduled colonoscopy time, finish drinking the remaining half container of your Go Lightly. Do your best to finish drinking all of the Go Lightly. We want you to have the best bowel prep possible because the cleaner the colon is, the better we can visualize the walls for any abnormalities. We may stop your colonoscopy and send you home with more Go Lightly if your colon is not clean and we can't see well. 2 hours prior to your appointment time, stop drinking liquids. You should take your heart, blood pressure, seizure, breathing, and Parkinson medicine as prescribed with just a sip of water. If you are diabetic, do not take any diabetic pills or insulin because this may lower your blood sugar while you are fasting. Your appointment time is printed on your appointment letter. Please arrive 1 hour early for your pre-op. Use your asthma and COPD inhalers in the morning and then bring them with you to your colonoscopy appointment. Please call the GI department if you have any questions. We wish you good luck as you prepare and look forward to welcoming you for your procedure.